AOA uses the Catalyst platform to deliver its longitudinal assessment. For those that are in longitudinal assessment or are maybe not familiar, there's 4 components to our certification process for our diplomates, and component 3 is what has historically been a high-stakes exam. But the AOA is now able to use Catalyst to deliver a continuous learning assessment, something that we can deliver on an annual basis to our diplomates, and it's able to provide that to them. So prior to using Catalyst and having longitudinal assessment, component 3 was a high-stakes 10-year, 8-year in some cases, depending on the specialty, exam in which our diplomates would have to study for. They would take an exam in a testing center or, after COVID, in a remote setting, and would have to study months prior to the exam and then sit down for anywhere from 2 to 6 hours for this exam at their computer. Catalyst now lets us allow them to take this annual assessment on their own time, on their own device, whether it's phone, tablet, or computer, and it's completely flexible to their schedule. Well, flexibility is key for the diplomate, giving them the ability to take questions in between seeing patients if they choose, or on a weekend when they have time to sit down at their computer or at their phone. But also from the side of delivering a prestigious certification process, we at the AOA have really enjoyed using Catalyst for longitudinal assessment because it allows us to deliver continuous learning opportunities to our diplomates. They get up-to-date articles on their practice and are able to continuously assess their own knowledge as they're going throughout their practice. Well, using the NBOME is almost a no-brainer. The AOA delivering certification exams, NBOME delivering exams to students coming out of medical school, we were already on a like mindset. And so partnering with NBOME to deliver something like longitudinal assessment was something that I believe has been in the making since we began working together. Our like-mindedness, our history with osteopathic medicine, I think there's a million different reasons why we used NBOME, but the great association that the NBOME has made it incredibly easy. So the use of Catalyst certainly supports the profession and improves patient care. We've created the content at the AOA. We have the configurations for longitudinal assessment, but each of our specialties operates a little bit differently. And Catalyst has been able to individually create assessments for each of those boards. Whether it's family medicine, who's allowing their diplomates to choose different categories that might be relevant to their practice because it is such a generalized practice. Or the Board of Surgery, which built a 60-item assessment that the physicians can take at their own time during the entire 3-year cycle because our surgeons need ultimate flexibility with their busy schedules. Catalyst has been able to support that so that the physician can do their assessment specific to their specialty.